This may seem crazy, but just addressing this one area can take years off your appearance almost instantly. The problem is, lower face laxity is a highly complex issue, and many providers use outdated methods that can actually make you look older. In this video, we're going to be discussing lower face rejuvenation, specifically how to get a tighter jawline and how to treat saggy jowls to erase 10 to 20 years off of your face. Stay until the end for a bonus segment where I'll tell you what I would do if I could only choose one treatment to get a tighter jawline and fix saggy jowls. All right, let's get into it. Hi, my beauties. My name is Dr. Stephanie Kappel, and I'm a board-certified, fellowship-trained cosmetic dermatologist in Newport Beach, California. As always, my content is non-sponsored. I get asked a lot, what is the best way to treat saggy jowls? And people are always interested in jawline contouring and how to get a tight jawline. Lower face rejuvenation is important to address for anti-aging because lower face laxity plays a significant role in the overall appearance of the face. When discussing treatments for lower face rejuvenation, it's important to understand how our face ages and the changes that happen over time as we gain wisdom and have birthdays. It's not only in the skin. The skin, of course, loses collagen, elastin, and all those extracellular matrix proteins that give skin that beautiful plump contour like we see in babies. As we lose that, the skin gets laxed, it starts to fall, the skin gets thinner, it gets more textured, pore sizes stretch out, acne scars and any asymmetry becomes more exacerbated or accentuated because the skin thins over time. But unfortunately, it's not just the skin that thins over time. It's the subcutaneous fat. It's the bony structure. It's that structural support underneath our skin that was holding things up before that starts to fall and it starts to sag. I always tell my patients, think of the skin as a tablecloth, and there's a table which provides structural support underneath that tablecloth holding it up. Well, not only is the tablecloth losing that elasticity and that resilience, but the table underneath is losing that structural support and starting to disintegrate. So you don't have that structure underneath that used to hold the skin back, that used to hold these jowls back. And on top of that, as the skin starts getting thinner and draping over that tissue, it's just a bad formulation for things going south. But the good news is that there's things that we can do to overall rejuvenate the lower face, not just by addressing the skin, but addressing the subcutaneous tissues that we once had to provide that structural support and give that lift, tightening, pulling effect that we once had. So let's talk about outdated methods for jawline contouring and saggy jowls. Over the past decade, unfortunately, I've seen other providers refer patients to me for overfilled faces. And I feel that this is an outdated method and something that has gone way too out of control, with providers using fillers to lift and tighten and contour the jawline. Now let's talk about fillers. Jawline fillers using Volux by Allergan, which is a very high G prime filler, which is engineered for jawline contouring. That's different than providers who are using Juvederm and other non-jawline contouring fillers to kind of fill the face and plump it up to lift it up, because that will only buy you about a year of time. But what happens is people start getting used to that tight full look, and then they go on year after year after year after year, and they're getting more filler and more filler, and they're looking distorted and pillow-like, and their kids don't recognize them and their friends don't recognize them, and they start to have these cat-like faces, and it's just awful. And it's this epidemic. You can see it in celebrities, you can see it at the award shows, you see it with influencers, and it's a bad look. And it's the telltale sign of someone going to a non-skilled provider, because that is not the way you tighten the jowls. That's not the way you do jawline contouring just by pumping up patients with a bunch of filler. The way you do it is you use tightening devices that elegantly, specifically, and very effectively stimulate your skin to act and behave younger, to make collagen, to make light, to make elastin, and to tighten that skin from within at a cellular level. You don't just pump people up with a bunch of filler to stretch out the skin and make the jowls look better, or make the jowls temporarily go away for a year, and then year after year you're coming back for more and more filler. Meanwhile, you're getting distorted with a weird looking face. So I always approach each individual patient with a customized approach, and we usually start with some type of jawline tightening device, either Ellacor or Thermage or an energy-based device, or even PDO threads or something along that nature that's going to lift and tighten the skin to redrape it over the area where it has started to sag. But when you do treatments to induce your skin's own regenerative processes to do the work to make the collagen, to make those extracellular matrix proteins that's going to lift and tighten and contour that face, it's a longer lasting and more natural look that is always preferable over just a bunch of filler. Another outdated method for treating the jawline and saggy jowls, in my opinion, is RF microneedling, or microneedling with or without RF. A lot of people think that this is a new technology. I've been using that technology since back in the around 2015 time. And we were super excited when this first came out. And again, because I'm non-sponsored, I could speak the truth, and I want you guys to have a resource on YouTube where you can get true information and honesty. And I used this treatment back in my fellowship, and we were super excited about the prospect of this new device, but we saw a lot of increased laxity and a lot of hyperpigmentation and almost like acne-like scarrings from the RF microneedling. And it was so bad to the point where we actually just had to get rid of all the devices. And I don't want to name the actual devices because I don't want to hurt anybody's business, but RF microneedling I'm not a huge fan of because I see a lot of complications also from other providers in my area who have used this device and send their patients to me when they have deleterious outcomes or side effects, hyperpigmentation, enlarged pores, the grid marks that won't go away, pox-like or acne-like scars, and people who had flawless skin to begin with and were just trying to do something more preventative and proactive, and now they're left with textured skin. It can thin the skin. Sometimes it can thin the subcutaneous tissue. So these are the things that I usually stay away from. Now, with that said, if you are a person who has had RF microneedling, any of the RF microneedling devices, and you had a great response, more power to you, and go ahead and go down that path with that treatment. But for those of you who are new and are trying to decide, you know, in the field of aesthetics where there's so much overwhelming information with different devices and technologies, which one to choose from, I wouldn't go that route first because I feel that more often than not, patients will have complications and can actually look older from these treatments. This is based on my anecdotal data and over 15 years as a cosmetic dermatologist and what I've seen along the way. For jawline and jowl treatments that can actually make you look older, I wanted to recap. Filler that is placed in an improper position and injection plane and location in the face can make you look older. The wrong type of filler can make you look older. But that's not to say filler can't be used for jawline rejuvenation. Like I said, Volux or a very high G prime or a thicker, more sturdy filler in the jawline can actually make a really beautiful rejuvenated appearance of the jawline. Other treatments that can age us or make us look older are any RF microneedling devices that can cause textural irregularities or thinning of the skin, or acne or pock-like scars can make us look older or more weathered. Certain skincare products can actually make us look older in the face. Now, I want to take this time to talk about vitamin A derivatives, retinols, or tretinoin, because there is a period of time where when you're using skincare, for jawline rejuvenation or even rejuvenation of any area of the face, there is this phenomenon called a retinized look to the skin, where you can paradoxically and temporarily look more textured or with more fine lines and wrinkles as you're going through this phase where your skin's getting used to the vitamin A derivative, whether it's a retinol, retinaldehyde, Tazorac, tretinoin, whatever vitamin A derivative it is. But once you stop, the skin will be plump and have more collagen and will have beautiful aesthetic results in the long term. It's kind of like going to the gym and saying, well, I went to the gym and I worked out and I'm sore, and this is no way to live life. I don't want to be sore all the time. Well, you'll start to go to the gym more frequently. You'll get stronger. Your muscles will get stronger, and then you won't be sore when you go to the gym, and you'll get a beautiful result from going to the gym without that soreness anymore. That's kind of how I treat and view retin A and vitamin A derivatives for my patients. So treatments that can also make you look older can sometimes temporarily include skincare. So a question that always comes up in my office is how to get a tight jawline. There are multiple treatments that we can use to rejuvenate that area. And like I said before, it can be customized on a patient by patient basis. And it's not just one treatment, it's multiple different treatments that have different mechanisms of action, either providing structural support under the skin, tightening the actual skin, and the methods that you can tighten the skin can include collagen synthesis and induction of collagen synthesis through heat-based devices like energy-based devices like Softwave, Ultherapy, Thermage, or there's many others, or mechanisms of action that can tighten the skin through actually removing little pieces of skin like the microcoring technology in Ellacor. Or you can have skin tightening. I wouldn't really consider it skin tightening with PDO threads, but kind of like a tightening and pulling effect of the skin that can also have other added benefits to jawline contouring, which I'll get into later. Hey guys, if you're liking this video so far, be sure to click the thumbs up button and subscribe to my channel. Your support means the world to me. Okay, back to the video for you and back to the beach for me. So next, let's talk about Thermage for Jawline and Jowls, and let's talk about Ultherapy for Jawline and Jowls. Both of these treatments are energy-based devices that put heat in the form of either radio frequency, in the case of Thermage, or ultrasound or microfocused ultrasound in the case of Ultherapy, or now SoftWave. SoftWave is the new ultrasound-mediated energy-based device for tightening, which is often used for jawline contouring. Now, when I make my recommendations, all of the energy-based devices I feel will provide some result, somewhat of a result. But Thermage is my favorite energy-based devices because you guys have to understand, I've been in practice for a long, long time, and even in my laser fellowship training, we trained in a multifaceted facility. It was a 2-story building with over 30 rooms with like 100 devices and lasers. And I remember one room had Ultherapy and Thermage in the same room, and I paid attention to which one gave better results in head-to-head studies. Pretty much is what we were doing when we were treating patients and seeing which ones had better outcomes, Thermage versus Ultherapy. And time again, Thermage always had more impressive results, more consistent outcomes, and happier patients. Now, a lot of these energy-based devices are very operator dependent. So people will often say, Dr. Capel, why do you like Thermage over Ultherapy or SoftWave? This is just my preference based on what I see. And in my office, the way we do Thermage is by a different protocol than you'll see in other offices. First of all, it's myself and my colleague who are both board certified dermatologists who really understand the physics behind these energy-based devices and how they work, and the vectors and the heat stacking and how to concentrate all those 900 pulses and which tip to use. There's a lot that goes into it. So when people will see mixed reviews online, my Thermage didn't work, or I'm afraid it's going to melt my fat, or my plastic surgeon doesn't want me to do Thermage before a facelift, there are a lot of things that contribute to different reviews that you'll see online. The most important thing I always tell my patients, if you're looking to have Thermage done, or any energy-based device, if you're getting it done at a med spa or having it done by a plastic surgeon, but it's really not the plastic surgeon, it's an extender who just started doing this treatment about a week ago and is YouTubing it in the back room how to do it, trust me, I've seen it. This is the back end of the aesthetics industry and the dark side that I don't want my patients to be afraid of, but I also want you to know. A lot of times extenders or med spas are using outdated devices. I get emails every day from my office because I always have top of the line lasers with the most updated technology, and laser brokers will come and try to buy my lasers off of me because they want to sell them to med spas, and they're these third-party laser brokers or device brokers which will sell outdated platforms, sometimes with mixed and matched parts that won't allow these devices to perform at their best level because they're used or they're outdated or they're from the early 2000s and they've been refurbished. You can't compare a device that was purchased or leased straight from the company with the most updated platform to an older based device that may be melting the fat or causing subcutaneous volume loss. So mixed together with a provider who doesn't really know what they're doing, it's like a recipe for disaster. So when you see things about volume loss or deleterious outcomes from energy-based devices or something like Thermage, it's always important to cite your source. Who's performing these treatments? Are their platforms and the devices that you're using the most updated? Because most physicians will buy, at least I can speak for myself, I'll never buy, a non-updated platform of a laser or from a third-party laser broker because I just feel that it's not going to be the best treatment possible, and then most outdated technology is not going to give the best outcomes, and it's going to have a high risk for side effects. So always keep that in mind when looking for energy-based devices. And when you're reading these reviews, just know it's very operator dependent. Because we're talking about skin tightening, I also want to address how to treat skin tightening with Ellacor. Now, Ellacor is the new kid on the block. It's microcoring. It takes out little microcores of skin, and I've done other videos on Ellacor describing the mechanism of action in which it works. It removes his skin in a scarless fashion and is FDA approved to treat moderate to severe rhytids, which are wrinkles of the lower face. And it does this by removing about 10% of the skin through these little microcolumns that it basically excises out and it gets sucked up in a vacuum. It sounds barbaric and it sounds horrific and it actually looks kind of scary if you see it, but it's not. And it works very well. I've used this device back in the clinical trials back in 2017 and 18. I was very impressed with the device then. It was recently launched in October of last year, and we incorporated it into our practice, and we've been very happy with the results, and our patients have been very happy too. Sometimes it may take anywhere from 1 to 3 treatments spaced a few months apart, and again, it actually performs better in people with more laxity than less laxity. Usually my patients who have, they're younger or they want to get ahead of the game and they want to collagen bake and increase their collagen stores so that they can hopefully slow down the aging process in the decades to come. Remember, we lose 10% of collagen each decade, so if you collagen bank and you do things to restore destroy your collagen, then over time, that's the true meaning of anti-aging. For them, I would usually recommend Thermage. But for my more mature patients or patients who have more laxity here, I feel Ellacor is a more meaningful treatment that's a little bit more invasive but has next level results. The caveat with Ellacor is that there is downtime. You have redness, you can have post-treatment erythema, you can have scar demarcations and redness in the area where the treatment occurred. You can also have bruising and redness in the area treated, but it usually lasts about a week, not much longer, and usually patients will come back 1 week after treatment and we'll do a little V-beam laser to get rid of the redness, and it's a non-issue. When it first came out, we were a little bit worried about that, but using this device for the past 6 to 7 months, it has not been an issue, and I'm very happy with the results, and my patients are too. Next, let's talk about how to tighten the jawline using PDO threads. PDO threads are a great way to mechanically lift up on facial laxity. Usually we place 2 to 4 pairs of the PDO threads in a scarless fashion that kind of give a lifting and tightening effect, and also are almost like putting string-like filler in the face. So they're made up of things like polylactic acid and biostimulatory filler components that are going to induce the fibroblasts, which are the collagen-producing cells in our skin, to make collagen and elastin and glycosaminoglycans and all those extracellular matrix proteins, which add volume in a very natural but beautiful volumizing manner. And so the PDO threads not only give a mechanical lifting, but they also are like a slow depot filler that's going to add volume too. You can use them on the lower face and on the neck to kind of accentuate and define that jawline as well. I'm a huge PDO thread fan. I just will sometimes start with tightening devices, but if people have already had a tightening device and they're happy with the results, but they want a little bit more, we usually end with the PDO threads. I rarely start with it unless it's for another indication. You know, we could do fox eye, we could do other things with PDO threads, but you have to keep in mind PDO threads can melt if you use energy-based devices. So you would never want to do PDO thread placement and then like a month later do Thermage. You'd want to swap those two. Do the Thermage first and then do the PDO threads afterwards, because you don't want to melt those threads. And again, like looking up Thermage reviews, if you look up PDO thread reviews, you may see mixed opinions and horrific outcomes with PDO threads. You'll see people talk about dimpling or scarring or seeing the thread through. When you're in the correct dermal plane, and as a dermatologic surgeon, I'm very comfortable placing these threads. I also participated in the clinical trials for Instalift, which was back in the old days, the thread lifts that we would use, and we did thousands of these cases. So the placement in the dermal plane and the correct dermal plane is something that comes very naturally to me. But for some people who are just starting out, and even in some states I've heard like estheticians and dental hygienists and hairstylists are able to place PDO threads, those people may have a higher risk of complications and a higher rate of complications because they just don't have the experience or training. And in my opinion, they probably shouldn't be performing these procedures, but you know, you can't help what's going to happen on the outside. All I can do is protect you guys from going to someone who's not highly trained and having a bad side effect from a treatment like PDO threads. But when they're done the correct way by an expert, the results are beautiful. So we've talked about a lot of non-surgical treatments for lower face rejuvenation, but next I want to talk about how to tighten the jawline using injectables and how to treat saggy jowls using injectables. Now, we talked about fillers already. Volux again is my favorite jawline filler, and it just provides that structural support and that definition that can separate the two cosmetic subunits of the face, jawline, and neck, so your face and neck don't blend into like one unit as we start to get bony resorption here in the jawline. Also, putting a little bit of that filler in the chin on a profile can give a beautiful AP projection, what we call the projection, which accentuates that chin and it helps define the jawline for a beautiful profile and oblique angle when looking at the face. Not all fillers are created equally, but with the right placement and with a small amount, not too much filler, it can really define and rejuvenate the lower face. Another injectable that's often underutilized is Botox. You may have heard it referred to as the Nefertiti lift. A lot of patients ask, how does that even work? How does jawline filler that usually relaxes the muscles, how would that define the jawline and make it look more defined and rejuvenated? The way it works is all the muscles in the face and neck are antagonistic and protagonistic on one another. So there's muscles that pull down and there's muscles that pull up. When you soften the muscles that are pulling down, the resting tone of the muscles that pull up contract and they give a beautiful tightening effect on the jawline. It's usually about 10 units per side, and sometimes we'll go a little bit under the platysmal bands too to just kind of snatch that lower face up too. So it has a really beautiful defining effect on the jawline with beautiful results. Again, Botox isn't going to last as long as Thermage results, which last about 5 to 6 years. It usually lasts about 3 to 6 months, but it's a great thing that we can do if you want to just add a little tweak to kind of define that jawline for jawline contouring. And another injectable for jawline contouring and saggy jowls that's often underlooked is Kybella. Kybella is deoxycholic acid, which is a fat dissolving solution which can actually define the jawline if you have a fullness here in the submentum. So this is called the submentum here, and a lot of us will have just increased adipose tissue there. I've actually treated my, gosh, how long ago was that? Maybe 5 or 6 years ago. I did a vial of Kybella here just to tuck that little area up under the chin. Now it's important to remember there's lots of fat dissolving procedures out there these days. There's liposuction, there's cool sculpting, there's Kybella, and there's probably some more that I'm not even mentioning. But you always have to remember when you remove fat, or if you take too much fat out, you can have laxity. So skin laxity is always something that you have to assure is not going to happen. So when I assess my patients in the office, if they want to define the jawline or kind of treat the kind of sagging jowls by doing a little bit of filler here and by debulking that fat pad underneath the jawline and the chin and the submentum area with Kybella, I always test the skin and pull in the skin to make sure that the skin turgor is enough to handle that fat loss, because fat's like filler. When you lose that fat, you don't want to have increased laxity making things look worse. Next, I want to talk about anti-aging skincare for lower face rejuvenation. Now, a lot of our actives that we use on our face, we can also bring down to the neck to kind of help rejuvenate that lower face area, especially under the chin and that superior neck area. But I also want to remind you the histology of that skin is different. It lacks the sebaceous glands number and density that we have in our skin on our face that makes us a little bit more prone to irritation to the same actives that we can use on the face without any irritation at all. So a lot of my patients will ask me if a retinol or a tretinoin, I usually will prescribe a 0.025% or very weaker tretinoin for that area. Yes, it can be used, but I always say mix it with some type of hydrator or barrier or moisturizer to cut down on that irritation, which won't affect the efficacy. They've done a lot of studies on that. So if you're going to take your vitamin A derivative down to this area, yes, it's okay to do, but I would say mix it with a hydrator. Either use a sandwich method where you put on the hydrator, the vitamin A derivative, and then more hydrator, or 1-to-1 where you mix it in the palm of your hand and apply it to that area. And I would only do it once a week to start with. You can build up your tolerance as your skin becomes accustomed to it. Another key ingredient I feel for this area is our Jawline, and that's why I engineered for my skincare line MD Air Neck Tight Serum, because that has our Jawline in it without getting into the pharmacokinetics too much. It alters the snap snare complex, which helps relax those thin little muscles that can often make that area look textured, and it helps with that jawline area as well. So you always want to pay attention to the active ingredients in vehicle delivery systems, because that skin is a little bit different, and those active ingredients are sometimes a little bit different that you would use on a daily or bi-daily basis on your face. And lastly, I wanted to end on redefining the term of a non-surgical facelift. In dermatology, we're always doing things to improve the way we look without having surgery, because surgery is not always an option for some of us, or some of us who are open to surgery want to postpone it for a little while. Or even if you do have surgery, you want to have your skin on your face match your results of surgery, because it doesn't look right when someone has a facelift but their skin is aging them. They have texture, they have brown spots, they have this mottled appearance that can age them. So the two go hand in hand. But I always want to make it clear that when we're talking about dermatologic procedures, it's not a non-surgical facelift, because we're only stopping at the skin. We're not moving around muscle or fat or redefining facial ligaments and repositioning the SMAS. We're just helping the skin look and feel its best, and hoping to postpone surgery for a later date. Or if surgery is not an option, these are things that you can do for a very well-balanced, natural, rejuvenating effect. Thank you so much for watching. Drop a comment in the comment section. Let me know what else you guys want me to talk about, what you want me to talk about next week. And as always, it's great seeing you, and I love you guys. Hey guys, if you're liking this video so far, be sure to click the thumbs up button and subscribe to my channel. Your support means the world to me.